After a bumpy ride on a dirt road in Kabwe town, we hit the road to Kigarama Health Centre III to assess the situation on the ground. By the road, a rusty signpost of a health center gives you a hint of what you are about to witness. Upon arrival, some of the structures are neat, concealing the mess inside the health center. At 4 in the afternoon, you can hardly see any patients around the center because the admission ward is in a sorry state. The inpatients ward is a dilapidated, rickety structure. The roof leaks, and it's also a sanctuary for birds. The health center does not employ cleaners, and the nurses have to multitask to clean all this mess. The center continues to grapple with understaffing. Only 7 members, including the supervisor, nurses, lab attendants. Out of the 6 workers who were transferred 2 months ago, only 3 were replaced.
You find one person is there to clerk in outpatient department and still has to clerk in the IRV section, that clinic.
One of the workers here told us off camera that some of the staff have in the past abandoned the health center due to poor conditions. In the compound is a vehicle that bears the resemblance of an ambulance. The interior of the ambulance are dangling wires, ropes, and broken headlights. Some of the expectant mothers have only this choice of the ambulance, very improvised, as you can see. This is where someone is supposed to be resting from, or the nurses to sit, as they transfer the mothers from the villages to this very health center 3. And also, if you look at the space, it is too small for even just one single person to lie here, and the bed is in a very sorry state. This improvised ambulance is used to respond to emergencies of all kinds. Sometimes medics here have to go as far as 15 kilometers to pick patients on dusty feeder roads. With a big hole, all the occupants are exposed to lots of dust. Albeit the poor mechanical condition of the ambulance, the health center has no driver.
So the only thing we can do is to communicate to that person and maybe look for his or her own means to take her to the hospital.
Often the lab attendant drives it in case of emergencies. While he's away, patients have to wait until he returns to have tests at the laboratory. However, the laboratory equipment cannot be used to trace for typhoid and other infections. It's only another far-flung laboratory at a health center 4 that can test for typhoid. In the corridors of the maternity ward hangs the expenditure of 950,000 shillings for the last 3 months. This money caters for the repairs, sanitation, and utilities such as power. A paltry 192,000 shillings is allocated to Health Center Outreach Program, where 6 staff traverse 4 villages to immunize children and provide other medical services to locals. We also visited Mabale Health Center II, which is 15 kilometers away. The center, which is meant to deal with emergencies, has only 2 nurses. When one of the nurses is sick, the colleague has to work without any breaks.
One person has to attend to patients with different ailments such as malaria and wounds, among others.
The center lacks basic kits to use during emergencies, including hydrogen peroxide and bandage, which is used to dress wounds. At various health centers in this locale, every day comes with its own challenges as the state of affairs continue to deteriorate. Sudhir Byaruhanga, NTV.